Hello, my name is Thomas Duffy. I'm a student nurse practitioner at Youngstown State University, and I'm here to talk to you about your APRN position.
Okay.
So, can you tell me about yourself?
Sure. So my name is Carly Tepsick. I am a relatively new grad nurse practitioner. I graduated in December from Walsh University, got my license, and then I started practicing this March. I previously graduated with my bachelor's from Youngstown State, and I graduated in 2018. Worked for a little bit at the Cleveland Clinic while going back to school. Ended up on like a med surg floor for a little bit, and then went to the ER, and then graduated, and now I'm working as an NP.
Nice. Well, I guess you're gonna have to tell me about that. So, describe your position and what specialty are you in?
So right now I'm working in a family practice. It's just me and another physician. It's his private practice, I guess you could say. He was privately owned for like 20 years, and now he's recently bought out by Southwood. So just started working with him. Again, started in March, so I'm only like 3 months in. We do see a variety of ages, so he takes full family practice. So we see newborns to elderly patients, and it's different day to day.
Awesome. That's so cool. Do you see yourself, or do you see an APRN influence in today's healthcare system? If so, how?
So absolutely. When I was interviewing for the positions, one of the biggest things when I interviewed for the place I'm at right now was the amount of patients he has to see per day by himself. So like it's nearly impossible at this point. He was seeing like 30 patients a day by himself without any assistance, and it was getting to the point where he could not fit anybody into his schedule. He could no longer take new patients on, so he needed someone else to join. So one of the qualities he said as to why he hired me over somebody else was I was a female. And I feel like when you look at a doctor, everyone assumes a doctor is a male, even though there's female doctors out there.
Yeah.
So one of the things that when they go to see their doctor, especially a female going to see their doctor, there's certain things they don't feel comfortable talking about. So that's something that they feel more comfortable talking to another female about, hence having a female nurse practitioner. So definitely being able to see the number of patients that he needs to see in his office and being able to take on new patients. So I can cover a lot of things that he can no longer fit into his schedule. So if his schedule is jam-packed and I have openings, but there's somebody who needs to come into the office, I'm available, and it makes it easier for the patient to come in.
Oh, that's cool. How is your relationship? How do you like working with the physician?
Definitely like him a lot. He is a good teacher, so I'm learning a lot as I go. I'm definitely, like I said, new, so I have a lot of experience to gain. I have a lot of knowledge I can gain, and he likes to teach. So he used to actually teach a physician assistant program through Mount Union, so he's really good hands-on. Definitely knows how to explain everything. Very smart guy.
Oh, that's nice to work with someone like that. Some APRNs have challenges in the community where they aren't accepted by physicians. So do you see any of these barriers and notice any other barriers that they have?
So I feel like, at least I feel accepted by like the doctor I work with and my coworkers, but I do feel like there's a huge knowledge gap between people understanding what an APRN can and cannot do. When I first started, a lot of people would ask me if I was their nurse and be really confused when I would do everything as far as, ordering their labs or prescribing their medications or asking specific questions that they didn't think a nurse would ask, and we'd have to go into detail about what a nurse practitioner is. It has gotten better now that I've been there for a few months.
Right.
There was also a little bit of hesitancy from patients who have been seeing the doctor since he opened up. So he has 24-ish years of experience now, and a lot of those patients that he sees have been there for the last 24 years. So at first, saying like, oh, if you want to see the nurse practitioner, you can. They were like, no.
Yeah.
I don't want to see the nurse practitioner. And I didn't take offense to it because, again, they've been seeing the doctor for 24 years.
Right.
So he slowly kind of introduced me to his patients as he would see them in the office, and I would just kind of follow him the first couple of weeks when I didn't have patients, so that way they would get to put a name to the face. And now a lot of people call in, and if he doesn't have an opening on the schedule, they're more than okay with seeing me because now they've met me, they feel a little bit more comfortable. So I definitely think one of the biggest challenges we face is just having people understand what we can and cannot do. And
True.
I mean, I feel like they're becoming more common, so like people are catching on a little bit, but like 10 years ago, you would never think to be scheduling an appointment with a nurse practitioner. It would be very rare because you didn't hear about it. Where like now there's less doctors available and there's more physician assistants, there's more nurse practitioners, so it's something that's just becoming more and more common.
Yeah, especially the older generation.
Exactly.
Definitely. Nurse practitioners, nurse anesthetists are also new and up and coming, so we have a lot of challenges we have to face, but like you were saying, as time goes on, they're coming more and more accepting, and hopefully society as a whole will start to accept us and recognize what we could actually do.
Exactly.
Are there any changes that you would like to see for us as advanced practice nurses?
As of right now, I guess I can't pinpoint an exact change. I think the biggest thing would to be like filling in that knowledge gap, like making sure people knew what a nurse practitioner can do and how they will help in their healthcare, or like what their actual job and role is in the healthcare system. I feel like people just don't know exactly what a nurse practitioner can do. So sometimes people just think you're a nurse and there's no difference between the nurse and the nurse practitioner, whereas yes, I'm still a nurse. I will always be a nurse, but I'm also a little bit more than what I could do as a RN with my bachelor's. I have a lot more responsibility. There's a lot more I'm available to do for the patient. That was one of the biggest things coming from an RN to now the NP is the role change. So I wish that maybe we could fill in the gap somehow for patients to better understand the difference between the nurse that you see when you go into the hospital who's taking your vitals versus the nurse that you're now seeing when you go into your doctor's office who is actually taking care of you and all of your medical problems.
Exactly. I think you said it perfectly. Key to advanced practice.
Yes.
Part of the nurse.
Exactly.
Well, I think that's all I have for you, and I thank you for answering all my questions.
Absolutely. Thank you for having me.